Good evening, today respected Chief Guest, Professor Siddaiah garu, members of the Research Committee. I think morning we had a long session, almost 1.5 hour on national education policy. Happy that wanted to tell about present topic today, NIRF, to educate our own medical faculty. Request of Professor Siddaiah is the Professor of MBA, as a principal. Later worked as a star of this university, and I have been teaching touring extensively on this subject accreditation. So I request Professor Siddaiah to start his lecture.
Respected Vice Chancellor Dr. Chandrasekhar garu, members of the faculty, doctors, students, and other medical professionals interacting with us. The session is on NIRF, that is the National Institutional Ranking Framework. It is conceived and developed by the Government of India. Now, most of the colleges in the country, they have been accredited or given ranking according to their performance and also their infrastructure. The current session is to give some overall idea about this NIRF and the methodology for ranking of medical institutions. Yes, the methodology for medical colleges or medical institutions is different from the methodology for others. So just to give an overall idea of what is that methodology and how the colleges can follow that methodology. And the time is very short, so we cannot go into the details of each and every parameter, but I could give you overall idea. 2-3 days back, perhaps some of you might have NIRF for different institutions, and unfortunately, no college from Andhra Pradesh is figuring in the top 50 of NIRF. So other states, they have their own representations in the top 50, including Telangana. The Osmania Medical College is within that top 50 colleges. But unfortunately, no college from Andhra Pradesh is figuring in that top 50. Why it is so? Why none of our colleges are in that top 50? that doesn't mean that no, we are not doing well and our colleges are not doing well and our colleges are not well equipped and so on. It is not that. What I understand is that the orientation, not that much for the colleges to follow the methodology given by NII. That orientation the colleges should have. Develop that orientation, uploading the required data in the portal to be given by NIRF. Methodology, some kind of methodical process, nothing else. You are not creating anything for this purpose. Already data is there. Suppose the teachers, how many teachers are there, how much of research, how much of publication, and how much of other things you have already. So the only thing is that methodically you have to upload that. You are not creating anything, but the only thing is that methodical means obviously you have to document every data which is relevant for this purpose. So the purpose of today's talk is just to orient or to motivate or to inspire our colleges to adopt the needed methodology to get ranking in NIRF process. First, we have to understand what's the purpose of this NIRF. Why we should have, suppose without having any ranking, any accreditation, any kind of a rating, some institutes might be doing very well. But why this ranking? Because when I visited some institutes across the country for that purpose, that is an accreditation agency, you know about it. It is a general accreditation agency for all the educational institutions in the country, including medical. So when I have visited the colleges across the country, I come across some of the colleges with their mindset that it's only for getting some kind of a ranking so that or some kind of a rank so that they can promote their institute in the society or in the public, like that. Most people, they think that way. But what I tell them is, it's not just to promote your institution. Promote, okay, you can promote in different ways. It is also one way of promoting your institute. More than that, there is a purpose. Purpose is, what is your purpose of your institute? What is your mission of your institute? What is the vision of your institution? To provide quality education. So to provide quality education means quality is having the different dimensions. Not one aspect of quality. It is all encompassing factor. You can think that. All encompassing means there are different elements being involved in that quality. So our purpose, our mission is to provide quality education to the students. How you can provide quality education? What is that quality education? Not only just teaching, but also other kinds of things like need to provide good teachers and also good research, infrastructure, and many other things are involved. So that's why NIRF has suggested 5 parameters. All those 5 parameters, they are not equal in weightage. Suppose the first 2 parameters, each one carries 30% weightage. Next 3, they carry different weightages. Suppose the third one carries 20% weightage, and fourth one and fifth one, each one carries 10% weightage. Like that, we have weightages. Again, within the parameter, there are sub-parameters. Sub-parameter carries its own weight or its own marks, or you can think that well. Now, why we have to dig into all these things? Parameters, sub-parameter, their weightage, and so on. Why we should dig into all these things? That there are certain parameters that are sub-parameters which carry more weight. Suppose if we are good at those highly weighted parameters, obviously our rank will be better. Suppose the last two parameters, each one carries only 10%. If you are good at each one of them, those two may not elevate us to higher rank, better rank. So that's the reason why we have to look into each parameter and also sub-parameters, and where we have to focus, that we have to decide. Of course, ultimately you have to cover all the 5 parameters, but each one of them, again, your focus should be somewhat higher or somewhat something like that. You have to give that kind of attention. Intentionally, you don't give, but the data which you have may not be sufficient to give satisfactory kind of performance as far as that sub-parameter is concerned. So with these few remarks, let me take you through some slides. Now the first parameter is given as teaching, learning and resources. The weightage is 0.3, that means 30%, and the total marks are 100. Now, within these, sub-parameters are there: students' strength, including doctoral students, 20 marks; faculty-student ratio, with the emphasis on permanent faculty, 30 marks; combined metric for faculty with a PhD, 20 marks; financial resources and their utilization, 30 marks. Now, when you look at them overall, what do you understand? Faculty-student ratio carries 30 marks; financial resources and their utilization carries 30 marks. So that means your focus should be more on these two. That doesn't mean that you have to neglect others. So that's why what happens is, suppose student strength, sometimes may not be possible in some colleges to get strength immediately. For MBBS, okay, but some other courses, you may not get sufficient strength immediately. Okay, so it takes immediately. What I mean is that no, first 2-3 years of existence of the institute, you may not get good strength. Afterwards, when you do well, you may attract the students. But as far as the MBBS and other medical programs are concerned, like MD, MS, and and all that, obviously you get strength. There is a good demand for those things, you will get. So that way, student strength, including doctoral students, okay, you will get 20 marks. There's no problem as such, as far as medical colleges are concerned, but other colleges may have their own difficulty. Then financial resources and their utilization. That also, financial resources, I think all are resourceful. All colleges, medical colleges in our state are highly resourceful, including government colleges. Perhaps the issue is how those resources are utilized. How those resources are utilized. So that we have to think of it. So these sub-parameters, they are given: teaching, learning and resources, 100 marks. The ranking weight is that. Overall assessment metric, that metric formula is given. Same thing, whatever I have just mentioned, the same thing are given in the karma form of equation. Okay, so faculty-student ratio, that is very important because most of the colleges that is missing, particularly private colleges. Maybe say and those institutions may insist on the faculty, but somehow some private institutions they are not taking things seriously and they are doing things their own way. That is not good for them, but long run it is not good for them because they need to have good faculty so that they will be able to provide good education. When you provide good education, then your existence will be, that is very important. College existence should be meaningful. Only when you do the things honestly. In the morning also, I talked about how they are equated with the God, that divine will. Divine will, but they have to exercise that divine will. But they are equipped with the divine will because they are doctors. Here also institutions, private institutions, they are private entrepreneurs. They think of their own profits and all that. Okay, let them get their own profit, but not at the cost of a quality of education. Quality of education is important. Faculty is very important because when I have visited institutions, not medical institutions, and other kinds of institutions like engineering, management, and science institutions, and faculty strength is not adequate enough according to the ratio, faculty-student ratio, as demanded by the government or government agencies. But please remember that it is in your own interest. It is in your own interest. In the survival of the institute, you should provide quality education. Student strength, including the PhD. PhD means here for medical institutes, PhD is not a big thing because MS, MD, DNB, those things are taken as equivalent to what you call PhDs. So that way you can build the things. Faculty-student ratio with the emphasis on permanent faculty. That's very important. Time regular faculty in the institution in the previous year. Regular appointment means the faculty. But I'm not criticizing anyone, but one thing is that having been in academics for 40, 50 years, what I have observed is that the institutes which provide quality education, whatever is the institute, whether it is a medical institute or engineering institute or management institute, whatever is the institute, whichever institute follows dharma, dharma. So if you follow dharma, obviously that dharma will protect us always. Follow that dharma in all the things, particularly medical. Faculty professionals you are producing, they should also be responsible to that. The promoters, the entrepreneurs who start the institutes, they should also follow dharma in their own in their regular activities, and ultimately it's the money and all that, it will not help the life. It's only dharma that can protect us. So combined metric for faculty with PhD or MSMD, because when we don't have PhD, PhDs are but here MSMD, MDS, and so on. So that's why, sir, I told you that they will tuned according to the requirements of the institute, medical institutes. So because they have put instead of a PhD, MS, MD, MDS, and all that. That wording is given by NIRF. It is not my wording. Financial resources and so on pertaining to medical discipline, excluding expenditure and construction of new buildings, average annual operational and so on. Because when I have visited institutes, most of the institutes, they spend a lot of money on buildings. Because the buildings are so visible, the computers are so visible, and so on. But less on invisible things. What is the invisible in education institution? Faculty. Faculty means the quality of faculty. That is invisible. People are there in the body. People are there, but the quality of that body, that brain is very important. So that is the missing in many of the institutes. Good faculty is required. So next parameter is research and professional practice. Ranking weight is again 0.3. It is as or as much weighted as you can publications. Combined metric for quality of publications, patents, and footprint of projects, and these things can be easily done in any medical college. Because in the morning also we were talking about the data and publications and all that. It was a private talk with the madam of this research and development in the entire university. So I was talking to her, and she also lot of data is available in medical institutions. The only thing is that we must decide how to use that data for publications. Very easy. Say people social sciences like me, data is a very big problem for us to write any paper, because we have to go in for different kinds of things to get data. But in the medical institutions, the data is spontaneously generated. The patient comes to the doctor, and the doctor puts some questions, and the patient replies, and the whole thing becomes data. You have to record it. Okay, you have to record it and store it whenever we require it, and you have to call out what is required, and accordingly you can publish the papers. It is very easy, because I am also a researcher, of course, not in medical science, but research is that kind of a mindset is the same everywhere, whether it's medical science or other kinds of subjects. That approach is the same. Something, you see, what is research? Research. Okay, something is search means already something is there. We have to search and unveil that. Until that means that is the research. Already some people have done that. Again, you are doing it. Okay, on the same topic you can do it. That's why we in a literature survey we mentioned that so and so what do you call study on so and so, and their methodology is this, their conclusions are this, their observations are this, but my research on the same topic perhaps is something. My methodology is different, my canvas is different, my canvas is different, my sample size is different, my analysis will be different, same thing. So that advantage no other institute is having. That is no other means, whether it's a science institute, engineering and management, or any other institute, doesn't have this kind of facility of spontaneous data generation. The only thing is that you have to record the data, store the data, and use the data whenever you require. Then you can call out and you can relate one data with another data with a different parameter and all that. And it is very easy. I think in 1 or 2 months you can have at least 1 or 2 good papers for each faculty, for each doctor. You can have it. Even you have instituted fellowship for research at undergraduate level. That's a good thing, because that research mind is created even at lower level. Because we have come to know about research only after our PG. Okay, there is something called peer research, and we have to do it. But when you are instituting these fellowships for MBBS students, means at the beginning itself, they have just entered into this domain. They are the beginners. In the beginning itself, they are given this kind of idea that there is something called research and we must do it. They can do it, particularly when they are doing internship. They are interacting with the patients, particularly. Suppose clinical at that stage may not be possible for them. XPM, that's the kind of things they can do it. But when they are doing internship, obviously that data will be available for them, because they are with the professors, they are with the doctors to examine the patient. They can they can switch on the mobile and record that, and they can read it and store it and publish it. So good thing NTR University has done recently, instituting fellowships for research even at MBBS level. So like this, the publish and grant, some grant also university can institute for some small projects. Project papers, okay. Some small projects you can identify. Some external professors, when you talk, they will suggest which projects in a particular area, whether it is a cardiology or nephrology or neurology or orthopedic, which project will be helpful for the society, for the students, for the faculty. You can identify small projects. It should not cost more than 1 lakh, 2 lakhs. Below that, small projects are also, see, big projects are there, crores, involving some crores. But small projects also can be done. So you can make some teams of students, teams of faculty. Suppose some ortho student, some nephrology student, some other neurology student, you can make a team and a project, and they can do the project, and they automatically that will culminate to a paper. It is a teamwork. It is interdisciplinary work. So when there is a problem, obviously neurologists, nephrologists, other people also get involved, including cardiologists, when there is a problem of heart. So that way you can identify the projects and form a team. The team management, teamwork, nowadays has a human lot of importance. There is no hierarchy. Now, even in companies, in corporates, and even others also, teamworks are happening closely. When companies are selecting employees, they look at the employees whether you can fit into the teams or not. Some are so temperamentally bad, they cannot get along with other people. Such people will not be considered. Forming some teams, drawing from different disciplines, whichever is the discipline, even SPM, you can combine with medicine, combine with the surgery, so on. Because it is the SPM is the all-encompassing subject. It covers the whole medical field, if I think. Similarly, research and professional practice for publication, metric for quality of publications, definitely, because there are peer-reviewed journals. I don't know about your entire journal, whether it is a peer-reviewed, what is the citation index and all that, you must know about it. But one thing is that not that every paper should be published in your own journal. You can think of some high-quality journals are there, peer-reviewed journals are there. You will get a good citation index. So that even one paper is equivalent to a PhD. One good paper is enough. Okay, so that people should remember, not that we should produce 10 papers, 20 papers, something like that. Even one good paper, innovative, something creative, some good idea you are sharing with the academics. That's enough. That one simple idea, you can get money also. Okay. That's how we have to encourage the people. That's the reason why we are going in for NIRF. It is not just to be in the top 50, top 10 or top 20. Okay, can be there and people will talk that we are in the top 10 or top 20 so that our institute promoted. That's okay. But other than that, we need something differently, that is the quality of education. Because in the morning also I was talking that when you go to the class as a teacher, you're a doctor and also doctor come teacher, professor. So when you go to the class, you have to go with the new things, always. Same topic, same thing. Suppose last class, last year, you have taught the same subject, but this year you are going to teach the same thing, but what we taught earlier should be different from what we teach here, because we are going with the new insights, new ideas, new kind of things to be undertaken by the students. That's how teaching teaching becomes innovative. Teaching becomes research based. The same thing, quality of publications, where different weights are given. Patents also, these days, patents, it is not difficult because they have streamlined the process also. How to get the patents, there is a process for that, and the process is streamlined now because the government is encouraging the people to go in for patents, because the government is comparing our patents with the patents of other countries. Suppose in China, how many patents? In Russia, how many patents? In America, how many patents? How many? Because you know that now, though our country is so big with 1.45 billion people, with a lot of education infrastructure and all that, large number of universities, large number of colleges, even medical colleges also, largest number of medical colleges in our country as compared to other countries, 780, something like that. It is not a small thing. But when it comes to quality papers, when it comes to patents, we are lagging so behind. Okay. The only, I have also worked with the universities and research departments. I have also seen, also observed what they have been doing is that what they have been thinking is that quality research, original research is the domain of R&D departments of the companies or government institutions, R&D labs and all that. Okay, that's not the case. So every institution should have the mind to get at least one patent in a year. Suppose the entire university, you have number of colleges, not only medical colleges and other colleges, IH and all that, you have number. So at least one patent, whether it's a nursing or medical or whichever side, okay, physiotherapy, you can get to one patent. Nowadays, it is not that difficult because we are supported by technology. And the data is available. Lot of data is available. The only thing is that you have to collect the data required for our purpose and do the things. And when you do something innovative, obviously you will get patent. And you will, if at all you are interested in having a lot of money, you can also have money. But focus on this. The same thing, projects also. Then the third one is graduation outcomes. It carries 0.2 weightage. Combined metric for placement and higher studies. Of course, it is not a big thing. Colleges, because placements automatically. Perhaps in other nursing and dental, perhaps placement may be difficult for and all that placement may not be that difficult. University examination and metric for number of PG students graduated, metric for number of super specialty students and all that. Again, they're all governed by the university rules because they cannot have a large number of PG students. They cannot have any number of super specialty students because there is a government regulation or a university regulation. Within that framework, they have to act within that. So again, the weightage and how it is distributed. Okay, so this is given. The number of first weightage is given. PG students also, PG students are also given 30% weightage here. Placement and higher studies. Perhaps graduating students placed with the previous 3 years. Percentage of graduating students who have been selected for higher studies. That is again very important because what happens is that you produce some 100 or 150 graduate students. How many of them would go in for PG? How many of them are able to get PG seat immediately? Or how many of them are stopping at MBBS level or going in for non-medical? So these are all the things. Because if your institute is so good, obviously, graduates will get into PG course anywhere in the country. So because nowadays what happens is PG has become a basic qualification as far as I understand. It has become a basic qualification for any medico. So MBBS means here with the MBBS, many big great doctors used to do clinics and other things, but nowadays PG has become a basic qualification. Obviously, we have to encourage the students to go in for encourage in the sense that we have to provide the required facility for them to get into PG programs. Because why people are going for Kota, Rajasthan to have coaching and other things? Why not we have similar kind of things, not a coaching kind of thing, but something to motivate the students to have that kind of knowledge to crack the examination, NEET examination and all that, and encourage them. And you can also have the target that, okay, 100 students we are producing, at least 70% of the students should get into PG somewhere, some branch. That can be your target like that. Examination percent of students has this is also very important because what is happening is that many of the medical students are also failing. And many of the medical students are also getting less than 60% marks. Okay, marks do not matter, but in the morning also I was covering about the technology which can assess the students on different parameters. Technology can assess on different parameters, whether the diagnostic parameter or other parameters. How they fare, that assessment can be done with the help of the technology, particularly this virtual reality. That can you can take advantage of the technology and have assessments and see that the students get good marks. Good marks means the marks should reflect the knowledge and skills of the students. That is very important. That's why we take the help of the technology to assess students properly. Because what happens, say, if you give marks, let's say 60%, 70% or 80%, but are they competent enough to be deserving for 70%, 80%? That is very important because after all, the doctors, medical professionals, they deal directly with the lives of the people. Okay, engineers are there, management people, they are also deal with the lives of the people. Everyone in the society for the betterment of the society, for the lives of the people. Even the government is also for the welfare of the people. But the doctors directly, no other profession is having that kind of contact with the lives of the people as the doctors. So that's why while examining the students, while assisting the students, we must see that no students qualified to become good practitioners, good doctors. Average number of PG students graduated over the previous 3 years. Super specialty students graduated. Outreach and inclusive ranking, of course, the university doesn't have much say in that, or colleges may not be having much say in this, because what happens is, according to the rules, you have to make admissions based on a women reservation or SC/ST reservation and other kind of reservation, physically handicapped reservations. According to that proportion, we have to make admissions, and we cannot deny. Perhaps you don't have much say in that, but you can just document all this. Outreach and inclusivity, the same thing. Percentage students from other states, again, it is governed by the university. Right? Of course, now our state is also open to other states for admission. Earlier, it was not like that. So perhaps you will get the diversity. Again, women quota is there. Perhaps get this. Economically and socially challenged students also much cannot be done by the student, by the institutes, because this facility for physically challenged students, that they can do it. But as far as the diversity is concerned, and we have to go by the rules of the university. So physically challenged students, even now technology, visually impaired students, they can see the images. That kind of technology is developed. Visually impaired students. So they can see the images, they can make out something, and they can do the things. So that kind of technology is available. Perhaps some colleges think of acquiring that technology, the facility of physically challenged students. Then peer perception, employees and academic peer, of course, it is very important. It carries only 10% weightage, but it is peer perception. How do you get peer perception? So here, employees and academic peers, how do you get peer perception? When you are so good, obviously, everyone says that so-and-so college is so good. Okay. So like that, suppose Colonel Medical College is so good, many people say. And the employers also say that, graduates from Colonel Medical College or some other Kakinada Medical College, Rangarai Medical College, or Guntur Medical College, like that. But private medical colleges, I think they are yet to establish themselves in the perception of the public. The perception of the public might be having their own image and all that. I don't deny it, but public perception should take them into confidence, and secondly, they have to project that institute as a good institute, because for that there is a weightage of 10%, and there is a methodology for them how to get that peer perception, employer and academic peers. They have evolved some methodology to get the perception from different employers and academic peers also. This is done through a survey conducted over a large category of employees, professionals from reputed organizations, and large category of academics to ascertain their preference for graduates of different institutions. Comprehensive list will be prepared for various sectors and all that. See, the thing is, suppose conferences, seminars, workshops should be held as frequently as possible, involving or inviting people from other states and other countries also, so that you will get that kind of what you call identity. You will get your own identity amidst many people, because when you are organizing one workshop, seminars, a conference, 1 or 2 days conference means obviously people from different areas, different colleges, they assemble here. Obviously, our institute image, that what we call visibility. The institute should have proper visibility in the public, in the society, so that you will get whatever kind of a thing you expect from the society, from the public, or from the government, and from the peers, and so on. So to become visible means there are 2-3 ways. One is the publications. Publications, suppose your article carries the tag of NTR University, name of that NTR University. Obviously, that goes into the minds of several people, whoever reads that article. If it is highly cited article, journal, highly peer-reviewed journal, obviously people, they cite that article and so on. That is having some kind of a multiplier effect. An article written by one professor of our university, obviously that is cited by 10 people, though again 10 people, again 10 more people, they cite our own article in a different context and so on. That's how visibility comes in. That's one thing. Another thing is that the books also can encourage the people to write books, because readable, books are readable, because not with high quality. Perhaps high quality, they can do it. Even, you see, when you look at the society, people from small background, with a small background, people from lower, and I don't say lower, because from people of first generation educated, I can say that way, first generation educated. Okay, for such people, we need some books. Because the authors which we refer, high, what you call, language and quality is so high, of course, but these people come from uneducated background and so on. Obviously, they may not be able to follow such books. So we need to have catering to such sections of the people. Incidentally, I tell you, I ventured to write a book after going through several books in our domain, because those books I could find what is missing in them, catering to the needs of the average students. So keeping in view the average students, some textbooks have to be developed. So we have foreign authors and big professors having written good books, but sometimes they may not be able to be followed by the average student, because lower stratum of the society, with local language background may not be able to read in English and follow. So for such kind of people, You can encourage the professors to write, not low quality, but different language suitable for such a students. You can encourage the professors to write good books. That's one thing. Another thing, as I have mentioned, the conferences, workshops, and seminars, online also. Online also, you can have conferences. Suppose I participated in international conferences through web, online. So they are as effective as physically attended conferences. So even every college you can have one small topic. You can have Zoom. All kinds of students and doctors and other people. So here they upload ranking framework. An education institution must register. So this is the procedure. Register on the official NIRF portal, fill in their institution profile, download a provided Excel template, data into the correct format within the template, and then upload the completed Excel for review and processing. So steps for data upload, it is all given in their website. I am just download it and showing this as for you. The same thing. So finally, what I suggest to you all is, first, you have data, you document that data. Classify that data according to the parameters. You have data. Okay, number of teachers, number of papers, number of projects, and so on. So many things we have covered. So you have all the data pieces. Like that, you have data. Then you can just document them. Proper documentation is required. So documentation means not that you have to write on the paper and all that. Not required. All the soft copies are enough. Okay. So that way you can document it, and when no. Let us see all institutions in this university. Let them participate in this. Perhaps they may keep it. They may open it. They may keep it open from January for some time. Them upload their data. Let's see where we figure. Then we can improve it. We are not by any chance, if you are not in below 50 or but next time we can try. Where we are missing. Thank you very much. Any interactions?
Yeah, few I can enumerate, sir. It was a nice, introduction that what you have given us for NIRF ranking. So, know that publications in peer-reviewed and books don't have the same weightage. How do you actually weigh both of the things? The weightage given to the number of books published by the faculty versus the publications part. I'm just asking, is it the same weightage for both of them, or is it different?
That's one thing. Another thing is, as far as books are concerned, who is the publisher? So, by the publisher, suppose the Tata McGraw-Hill, like that. Suppose international publishers, suppose Pearson Education, international publishers. If they publish your paper, obviously you will get ranking.
So it all depends on the publication.
Publications, sir. Not number of, that's why they have put some F is there,
Yeah.
function.
Yes.
So function they will decide.
Okay.
I think in that formula F is there.
Just had F, so I didn't know what that was.
Somewhere they have mentioned that they would decide.
Okay.
Keeping in view the quality of that particular journal and all that.
The second question is, I mean, as you have seen that medical colleges, we don't have a PhD program as a main program for the university. And we have a lot of MDs, MDS, and all postgraduate level teaching and even super specialty teaching. I mean, how do you rate them as equivalent to, I mean, the weightage given as equivalent to PhDs? Because internationally, PhDs are after your super specialty also, because I had my colleagues doing PhD after cardiology as well. I mean, I actually started PhD, but I didn't finish it. But yeah, how do you rate PhD in equivalence to all postgraduate and super specialty degree?
Sir, one thing is PhD is substituted as MCH, like that. I think methodology itself speaks about that. So we need not go for PhD when we have all this and MCH. That is a super specialty kind of a thing. Another aspect is what is the PhD research? Suppose you do some research and get that research published. Because medical, they are insisting on PhD. For medical, they are not insisting on PhD. They are MCH, MD, DM, and super specialty, they are considering.
So the question is, because we don't equate MD to DM or MCH. So is there a different weightage is my question. I mean, for MDs and MDS versus DMs and MCH.
So it is a super specialty, DM, MCH, super specialty courses. Obviously, they have edge over PG courses. But when we compare the PhDs, perhaps that comparison may not arise because that's the substituted.
Chat box lo కొన్ని ఉన్నాయంట.
Sir, good afternoon, sir. Sir, good afternoon, sir.
Good afternoon.
Sir, thank you once again, sir. Honorable V.C. Chandrasekhar, sir, as well as our Professor Siddaiah, sir. Sir, one small doubt, sir. Thank you for an excellent talk, sir. Sir, how can a medical college like us, with the limited funds, improve its research score in NIRF, sir?
Sir, what is research, sir? For that funding is so much required. Do you think so?
Sir, sir.
Funding is not so much required for medical research.
Yes.
Huh?
Sure.
No, at the college level, I am talking about. In
Yes,
the
sir.
laboratories, of course, a lot of funding is required at a laboratory level. At a college level, I think whatever data you have, and you can have your own insights, and you can develop your own insights and publish that. But in R&D departments, there a lot of funding is required for medical research. But at a university level, I don't think you need that much of funding for research.
Sure.
But whatever funding is required, that is available for available at a college level. I think so.
Sure.
What do you say, sir?
Yeah.
This is Lokesh Idara, connect आपने.
You know, funding,
Sir.
there's not a problem. See, we are almost spending 75 lakhs rupees per year
Sure.
And we are also giving 2 lakh rupees for the faculty.
Yes, sir.
And now the EC, we have decided to put 10 crores money where the research committee has been formed. I told all the medical colleges,
Yes, sir. Yes, sir.
whether private or government, and even others also, dental colleges also, to start a research unit.
Yes, sir.
So money is not the problem, but only thing is we have to change our mindset.
Yes, sir.
It
Adaptable.
is what is required, and people have become lazy. I think they have to start functioning, and the Andhra Pradesh is not even up to 100 or 200 in the ranking.
Yes.
I'm sorry to say that that's why we have started this research.
Yes, sir.
And recently we have told now that we wanted to encourage the PG, broad specialties, and DM and MCH candidates also.
Sure.
Whatever projects will come approved with the local research committee, once it comes, we are there to help them and we'll release the grant.
Yeah.
One thing is that our
Thank-
principals, they have to change the mindset of they have to change their mindset, and they have to change the mindset of the faculty and the mindset set of postgraduates and also undergraduates.
Yes, sir. Yes, sir. It's a passion they should have. Yes. Thank you, sir. Thank you.
Sir, Dr. Lokesh, sir.
Can I speak to sir?
Sir, please.
Oh, thank you, sir. Thank you. Excellent presentation. I'm listening all 1 hour. For our answers, the publication in USA, like for case reports, you don't need funding. Retro analysis, you don't need funding. Meta-analysis, which is highest number 5 on the scale of the publication, you don't need funding. So you need the culture from the done. So what I request submit to Vice Chancellor, sir, request all medical college should have their own journal. Then they know what is the journal, how the publication. We started in RMC and it's going well. We requested GMC. So every medical college should have a journal. Even though we have, I think, I don't know what, 30 colleges, even if you do 2 articles, 2 editions, which is 70, New England Journal publish 52 editions every year. So even if we all colleges together, so my request is submitting, and also mandatory MBBS should publish something. 1 case report, 4 students, 1 letter, 4 students, something. Otherwise, this will not result, sir. And private colleges, they have tons of money, they can start publication. This money, nothing, 3-4 lakhs per year. So this might kind submission, sir. I just was there in Dublin with NMC chair and also WFME. They're coming with the PG assessment. So these are all comparisons. We have a lot of great things in India, a lot of great things. But there are gaps which we need. Thank you so much for this kind meeting, sir. Thank you, sir.
Definitely we'll start initiating. See that some results will be seen after 6 months, 1 year. So let us all work together, and definitely now the change in the mindset, and definitely the research committee is there. And so Dr. Surya Prabha recently joined, so director research, and Dr. Sudha is also there, director of publications, and also Karthik cardiologist, and we have formulated almost 10 members. We'll definitely encourage, and we wanted to even recruit the scientists also. So very soon, we'll recruiting scientists. I think these people will be monitoring the principals and also the faculty. Those are the academic principals are responsible. So they request all the principals to see that for this separately you keep one academic principal and start doing the. I think
Sir,
I've been saying.
One suggestion, sir. The academy, I go through the principles, everything. You need to put a separate vice principal for publication only, because they're too diluted. Academic cannot do everything. And also, when we ask for ethical permission, they're taking 3 months. Ethical permission should be granted immediately and online within 1 week. Otherwise, we have to slow down, sir. That's also we can. I can work with Surya Prabhakar madam and submitting my submission, sir. Thank you.
That is mindset has to be changed, sir. Even in Karnal Medical College, we got 5 vice principals. But what is that? What is it is correct? One person is peculiarly, I started then when I visited Karnal Medical College where I studied there. So I told that every monthly e-bulletin like that got to come out. The number of doing a lot of good work, but only thing is we are not projecting recording and projecting properly. That is the only thing. I think Some of the institutions are good. I think still it has to be improved. Okay. Thank you. Any other questions?
Sir, I think I'd like to read out what under the leadership of our Vice Chancellor Chandrasekhar Garu that we have taken from the research committee. Some suggestions and sir has approved it. So we are going to establish research units and ethics committees in every affiliated medical colleges, and we are going to write it up to all the colleges as well. And all clinical trials will be with the under the academic wings and the research committees. And SPM undergraduates are encouraged to write a paper every year so that we get large numbers of them, and to start research committees for writing groups as well, so that all these papers to be written can be encouraged, and the biostatisticians are available so that they can make good papers and good quality papers as well. And to start research methodology courses as for faculty and students every 3 months, so that we can encourage people to write and make sure that the quality is upheld as well. And this we are going to implement in due course of that time with our VC taking it very actively under the research wing. Thank you, sir.
Ready? Dr. Edakonda Prasad, Principal Siddaiah Medical College.
Sir, good evening, sir. Sir, వినపడుతుందా సార్?
Yes, we are listening.
Sir, good evening, sir. Nice presentation, sir. Sir, actually, Siddaiah Medical College, sir, we are having a good research unit, sir. One is MRU is there, and second one is CRCC, sir. That is the Clinical Research Regulatory Committee and sir. Actually, we are doing clinical trials, and MRU is a very strong unit is we are having, sir. We are having good funding from ICMR also, sir. So actually, మీకు adjacent గా మేము పక్కనే ఉన్నాం కాబట్టి ఏదైనా రీసెర్చ్ మేము కలిసి చేసుకుంటే కొంచెం మనం గుడ్ క్వాలిటీ ఆఫ్ పేపర్స్ NIRF రిక్వైర్డ్ టైప్ ఆఫ్ పేపర్స్ కూడా మనం ప్రజెంట్ చేయొచ్చు సార్. మార్నింగ్ నేను కార్తిక్తో కూడా మాట్లాడాను సార్. కార్తిక్ కూడా నాతో మాట్లాడాడు సార్. సో నేను కొన్ని ఇలాంటి ఫీడ్బ్యాక్ అంతా నేను కార్తిక్ ఇచ్చాను సార్. యాజ్ ఎ ప్రిన్సిపల్ జస్ట్ అడ్జస్టెంట్ టు అవర్ యూనివర్సిటీ ఐఎమ్ రెడీ టు గివ్ ఫుల్ కంప్లీట్ సపోర్ట్ సార్ ఫ్రమ్ మై MRU సైడ్ సార్. బికాజ్ MRU మొత్తం మన స్టేట్లో ఒక 4 సెంటర్స్లోనే ఉంది సార్ MRU. అందులో ఒకటి సిద్ధార్థ మెడికల్ కాలేజ్ సార్. ఎట్ ప్రజెంట్ MRUలో 42 ప్రాజెక్ట్స్ నడుస్తున్నాయి సార్. సో వాళ్ళకి ICMR ఫండింగ్తో ట్యూమర్ మార్కర్స్ కానీ లేకపోతే జీనోమ్ ఎనాలిసిస్ కానీ రీఏజెంట్స్కి అన్నిటికీ కనుక ఆ పేపర్ కనుక సెలెక్ట్ అయితే మేము ఫ్రీగా సప్లై చేస్తున్నాం సార్. దానికి కావాల్సిన ఎక్స్పెండిచర్ అంతా. సో మేము కావాలంటే మా ఇన్స్టిట్యూట్ పేపర్సే కాకుండా చుట్టుపక్కల జెన్యూన్గా ఉన్నటువంటి ఇన్స్టిట్యూట్స్ కానీ పక్కన ఉన్న మెడికల్ కాలేజ్లు ఎవరన్నా మాతో చేయాలనుకుంటే దే కెన్ హ్యాపీలీ దే ఆర్ ఇన్వైటెడ్, దే కెన్ వర్క్ విత్ అస్ సార్. సో MRU అలాగే CRC అని ఉంటుంది సార్, క్లినికల్ రీసెర్చ్ క్లినికల్ ట్రయల్స్ అని చెప్పేసి ఏదన్నా ఫార్మాస్యూటికల్ కంపెనీస్ కానీ ఏదైనా ఆథరైజ్డ్ ఫార్మాస్యూటికల్ కంపెనీస్ కానీ ఏదైనా క్లినికల్ ట్రయల్స్ చేయాలంటే మా దగ్గర ఎథిక్స్ కమిటీ ద్వారా పర్మిషన్ కనుక తీసుకుంటే దే కెన్ కండక్ట్ ట్రయల్స్ సార్. ఎట్ ప్రజెంట్ 14 క్లినికల్ ట్రయల్స్ నడుస్తున్నాయి సార్ గవర్నమెంట్ మెడికల్ కాలేజ్ అండ్ సిద్ధార్థ మెడికల్ కాలేజ్లో సార్. ఈ 2 సార్. అలాగే MU యూనిట్ కూడా మా దగ్గర ఉంది సార్. MU వాళ్ళు రీసెర్చ్ యాక్టివిటీ సంబంధించినటువంటి BCMR అలాగే CISP అన్ని వాళ్ళు కండక్ట్ చేస్తుంటారు సార్. జోనల్ CMEs కూడా వాళ్ళ కంట్రోల్లో ఉంది సార్. అలాగే VRDL కూడా మా దగ్గర ఉంది సార్. వాళ్ళ కంట్రోల్లో కూడా మేము రీసెర్చ్ పేపర్ చేస్తున్నాం సార్. ఓవరాల్గా సిద్ధార్థ మెడికల్ కాలేజ్లో రీసెర్చ్ కొంచెం సాటిస్ఫాక్టరీగానే ఉంది సార్. హీర్ ఆఫ్టర్వర్డ్స్ మార్నింగ్ కార్తిక్తో కూడా మాట్లాడాను. సో నేను ఒకసారి యూనివర్సిటీకి వచ్చి మీతో కూడా మాట్లాడి సో రీసెర్చ్ మా దగ్గర మీ దగ్గర కొలాబరేటివ్గా వేరే మెడికల్ కాలేజ్తో కూడాను ఎలా చేయొచ్చో కూడాను మనము డిస్కస్ చేసి భవిష్యత్తులో, ఎందుకంటే ఇప్పుడు 223 మెడికల్ కాలేజీలు NRIFకి అప్లై చేస్తే ఆంధ్రప్రదేశ్ నుంచి ఒక మెడికల్ కాలేజీ కూడా NRIFలో ప్లేస్ సంపాదించలేకపోయింది సార్. ఓన్లీ 48 మెడికల్ కాలేజ్ 50 మెడికల్ కాలేజీలో ఓన్లీ ఉస్మానియా ఒకటే వచ్చింది సార్. సో నెక్స్ట్ ఇయర్ 2025-26 కల్లా మనం కొంచెం రీసెర్చ్ యాక్టివిటీ కనుక ఇంప్రూవ్ చేసుకొని NIRFలో అట్లీస్ట్ మన టార్గెట్ ఫస్ట్ 100లో కనుక ఉంటే that is a great achievement for this time sir. So this is my feedback from Siddaiah Medical College sir. అలాగే ఇక్కడ లోకేష్ గారు కూడా ఉన్నారు. సో లోకేష్ గారు నాకు కూడా మాట్లాడారు సార్. నా ఇన్స్టిట్యూట్ నుంచి కూడా సిద్ధార్థ నుంచి కూడా నేను ఒక జర్నల్ స్టార్ట్ చేద్దాం అనుకుంటున్నాను సార్ విత్ ద సపోర్ట్ ఆఫ్ ది లోకేష్ ఆల్సో సార్, యాజ్ దే స్టార్టెడ్ ఇన్ రంగరాయ మెడికల్ కాలేజ్. సో దిస్ ఇస్ మై కైండ్ ఇన్ఫర్మేషన్ ఫ్రమ్ సిద్ధార్థ మెడికల్ కాలేజ్ యాజ్ ఎ ప్రిన్సిపాల్ సార్.
Thank you, sir. Thank you for your Seeing that Jill is there with you, I think I request all the other college principals also to start this one. Only thing is you have to spend some time, that's all. Only 10 minutes time to think about those things. Definitely we'll be there as at a university level. Our support will be there. Full support will be there. But only thing is change the mindset of our team.
So thank you for your excellent presentation, sir. Once again, in the morning and in the afternoon also, both lectures were quite informative for us, sir. Sir, my only question is related to patents. How to apply for patents, if it is bio devices or if it is like some treatment related issues, that we want a detailed clarification regarding that. And the second most important thing is related placements for institutions, sir. Like 150 students joined in 1 year. At the end of 5 years, how many of them got their postgraduates? How many of them joined in jobs? That is there any mechanism to maintain that placements from each institution, sir?
First question, I don't have much knowledge of it as far as patents process is concerned. Perhaps you may check with the websites, relevant websites, where you can get the process. I'm sorry about that. And as far as the placements are concerned, what you can do is that at the end of internship, you can have one kind of meeting with the students and take their what you call you just request them and you be in touch with so and so faculty of the college, and better you inform us your career developments, where you are, how you are progressing, and all that. And that way, we can be very happy with all our alumni. Like that, you can encourage them to give the developments. Another thing is you have to extend invitation to them. Whether they come or not, that's a different thing. Suppose the convocation. All the students mail. It doesn't cost. It's only soft copy. When you have mail ID, you can just send it across. So that they will also feel that our alma mater is still remembering us. So when you expect them to communicate to you that where they are and how they are and all that, and reciprocal, you should also do something like that, and you should keep mailing to them whatever developments are taking place. Suppose new vice chancellor has come, and you can just mail his profile to all the students, at least last 10 years. Perhaps if you have mail ID, bulk mail IDs you can generate and you can send them. Or suppose your convocation or some conferences like that. So that way you can be in touch with them, and you should also expect them to be in touch with you so that their developments. But here database has to be created. University level database has to be created, and it is to be maintained also. Created and maintained, so that automatically the mails are generated and sent to them. Human intervention is not required. We have technology that automatically messages are generated and sent to their mail IDs or sometimes their contact numbers. So that way you can do the thing. So that you will be knowing after MBBS what they are doing, whether they have joined the PG program, which program, and all that. After that, placements like that, you can.
Madam, I have about this PG seats. It's very difficult, ma'am. Nationwide, you need to get a data from DNB, from because our Andhra Pradesh people go to Punjab, so there's no way NTR University have all the data. So in nationally, we have to collect the data. So NMC, I may write to them, but VC sir can write a letter. So data of all the PG seats, which college, where it is, then that can be repressed and published in their own. There's no way in the world without the national motivation, public collection, a college cannot collect it. It's very difficult. Thank you.
Individual students should give the data. Don't go for any mass data. Individual students, they keep posting their developments. At least some students, they do it. Because when they change the companies, change the hospitals and so on, they keep posting their developments, career developments and all that. That's why I said that from university side also, from the institution side also, there must be something, some invitation, something. Okay, so and so is happening. So I don't know whether the alumni association is there in the university. Otherwise,
Individual colleges.
Individual college,
yeah, if it is the registered, they can what from alumni association that is allowed to be defunct. Okay, allowed to be defunct means it won't function. Not happen. Every year there must be some activity of alumni. There must be some activity. So it must be registered and there must be some activity. So when some activity means that they can sponsor some workshops or seminars, something, they themselves would participate. Like that, they can have 1 or 2 days program. And alumni, if they are very, very resourceful, they may also contribute money to the colleges and sponsor some blocks or some hardware of the company.
they're doing. But only thing is, academic knowledge also can be shared. That's what. Doesn't when they come and visit their native places and all, the love and affection. I think there are so many good people. Lokesh is a good medical college student. He contributed a lot. So like that, there are number of people are there. Even AMC, Andhra Medical College, Rangaraya Medical College, Karnal Medical still has to start. There is a still under this one. People are there. Only thing is you have to tap them, and at least not in a financially, then academically also they can help the institutions. So with this, I thank Siddaiah Garu. Since I know him as from 1988, when I joined as assistant professor of medicine at SU Medical College after my completion of MD. So he's a friend, philosopher, and mentor and guide. So that years I have seen him after 13 years of my this one years come to my first daughter's marriage at Katona. After that, I've been seeing him and has been doing after retirement and also giving lectures and is a visiting professor and a NAC accreditation also is participating. So he came all the way, almost he was here for the pre-convocation, convocation and today also. So since he has come all the way from Bangalore, so let us utilize the opportunity of him. I think there's a marathon teaching from the morning. So I think we have to hats off to his zeal of working, sharing the knowledge. And we thank you, sir, from our bottom of the heart. The university is indebted by you. A small token of felicitation to you. Thank you.
థ్యాంక్స్ డాక్టర్ గారు, మీరు నన్ను అభిమానంగా ప్రేమగా నన్ను ఆదరించిన దానికి, నన్ను పిలిచిన దానికి నేను చాలా కృతజ్ఞుడిని. అందరూ బాగుండాలని, మీ ఇన్స్టిట్యూట్ బాగుండాలని ఎప్పుడు దేవుణ్ణి ప్రార్థిస్తాను. నేను ఆరోగ్యంగా ఈ విధంగా మీతో ఇంటరాక్ట్ కాగలుగుతున్నానంటే అదంతా భగవంతుడి ఆశీస్సులు, భగవంతుడి బ్లెస్సింగ్స్. ఐఎమ్ 75, బట్ I don't mind in teaching 3-4 hours attested standing before the students. No problem for that. That's all good.